Good morning, everybody. So today we'll be discussing about E&M coding questions with answers, part 6. So hereby this might be the last part for E&M questions because totally 60 questions were added. And if you are looking for interview guidance training part, you can just WhatsApp me in the given number in the last slide. So let's get into the video. Welcome to Learn with Danya. In this video, we'll be talking about the most important interview questions for freshers, medical coders, and how to prepare those questions. If you haven't watched the previous part, I'll share the link here so that you can go through the playlist and understand the remaining questions, as well as you can make a note of those questions for your preparation. So let's get into this. First question will be, can modifier 25 be used with preventive services? Absolutely yes. Modifier 25 can be used if a problem oriented E&M is done in addition to a preventive visit and is separately documented. For example, 99395 is for preventive plus 99213 along with 25 modifier for problem oriented condition. Second question, what is modifier 57 and when is it applied? Modifier 57 is used when the E&M service leads to the initial decision for major surgery, that is a 90 days global period. For example, a patient evaluated for abdominal pain, decision made for cholecystectomy. So here we will be adding that evaluation and management code along with 57 modifier. Next, can modifier 57 be used for minor surgeries? Definitely no. Modifier 57 is only used for major surgeries with 90 days global period. Modifier 57 is used when E&M service result in the decision to perform surgery. It is intended only for major surgeries with 90 days global period because this procedure require preoperative evaluation and decision for surgery. Next question, what is modifier 59 used for? Modifier 59, these two procedures are separate even if they look similar or usually billed together. Some procedures are normally bundled by insurance. If the doctor does two procedures that are really separate, use modifier 59 to tell the payer, pay for both, they are not the same thing. Hereby I have given an example also, you can go through it. Next question, what is the difference between modifier 25 and modifier 59? Modifier 25 is used when the doctor does a separate E&M procedure on the same day as a procedure. Think extra visit on the procedure day. Modifier 59 is used when the doctor does a separate procedure that is normally bundled with another. Think extra procedure that is different. Next question, what happens if modifier 25 is not used when required? If it is not used, then the E&M service will be denied or bundled with the procedure by the payer like insurance. Why this happened? Without modifier 25, the payer assumes the E&M visit was a part of the procedure, not a separate service. So they will not pay for separate E&M service code. Can modifier 24 and 25 used together? Yes, modifier 24 and 25 can be used together, but only when both are truly needed and the documentation supports two separate reasons. So they can be used together if the patient is in the global period of the previous surgery. On the same day, the doctor performs a minor procedure after doing E&M for a different issue. So hereby I have given an example, go through it. Next question, what is the difference between time-based and MDM-based coding? MDM-based coding is used when the documentation focuses on problem data and risk. Time-based coding is used when more than 50% of the visit is spent in counseling or coordination of care. Example is also given. Please go through it. If a doctor spent 35 minutes, mostly discussion, so we'll be going with the time management code. 59. What is telemedicine? Telemedicine means providing a medical service remotely using audio, video, or other electronic communication between a provider and the patient. For example, in the documentation, it will be clearly given a doctor consulting a patient through Zoom Meet or Google Meet. So in this case, we should give the code for telemedicine. Last question, what is the CPT code range for telehealth E&M service? Telehealth E&M service use the same office visit CPT codes 99202 to 99215 but with a modifier or place of service to show it was done virtually. So that's all about today's question. So please go through it and understand, make a note of those questions and keep, so it will be really helpful for you while preparing for your interview. If you are looking for interview guidance training part, you can join with us. I'll completely guide you with interview questions, as well as will support in the placement also. Thank you so much for watching. Wish you all the best. Take care. Bye bye.